Hello and welcome to Healthcare Careers in Focus. Today we're going to be exploring the role of a social worker. We're very privileged to be joined by two social workers with us today, Ruth and Sally, and they're going to be talking to us about their roles and responsibilities. So I'd like to start by introducing you to Ruth. Hello, Ruth.
Hello there, and hello everyone.
So thank you very much for agreeing to be here today. So if you could please tell us all about your role and what it is that you do.
Thank you, Kate. So hello everyone, my name is Ruth. I'm a social worker and I'm currently in the position of Deputy Team Manager, and I work in a team that supports people with mental health conditions who require support from adult social care. So if we go to the next slide, please. And I'm just going to tell you a little bit about my career journey. So I studied for my social work degree later in life. I initially completed a music degree in my early 20s, and I worked as a peripatetic music teacher in Essex. I then wanted a change in my career, and I decided to do a master's degree in social work. So in order to get on the course, I had to have relevant experience. So I worked part-time the year before my course, and I volunteered with 3 charitable organisations. So one of those was the local hospice, and I worked as a bereavement support worker. I also worked for the local rape support centre, and that was providing emotional support to people who were waiting for counselling. And I also volunteered at the local women's refuge. These volunteering positions, they provided valuable experience and preparation for my social work degree, and ultimately for my social work journey as well. Since qualifying, I gained experience as a social worker, and I've worked with adults aged 18 and upwards with a range of needs, and they've included physical and sensory impairments, learning disabilities, autism, and mental health conditions. Gaining a wide range of experience has helped me progress, and it's helped me develop in my career. As I grew in experience, I became a senior social worker, and I held more responsibility for holding more complex cases, as well as providing team support and guidance. A further progression has been to the position of Deputy Team Manager, and I've been in that position now for over 2 years. This is a change in the role. It's about having more management responsibilities, with my team now becoming my caseload. So as a part of my role, I'm still responsible for leading on practice within the team, highlighting areas for development, and supporting the team to grow and develop their own skills. As an experienced social worker, I've also gained a qualification in practice education, so I now regularly support students on their 100-day placements of their own social work degrees. If we can go to the next slide, please. And I'm just going to talk you through a day in the life, and this is going to be from a team perspective on what the workers might experience. So a day in my team always starts off with linking together as a team. Following COVID, the team now have a flexible way of working. So sometimes we have joint office days and we all come into the office together, and other days we work from home. So we always connect with each other in the morning, and this ensures that staff feel supported. We can discuss any issues that have arisen, staff can seek guidance on cases, and we keep those lines of communication open. The social workers may then need to go on visits to the people they're supporting. This might be in the person's home, it might be in a care home, it might be in a hospital ward. They'll meet with the adults and their family members. They might also meet with the care agency staff who support the person on a daily basis. It's really important that we gather as much information about each person we support so that we can understand what their care needs are and what their wishes are, and ultimately what support they might need. Sometimes a pupil is able to get access to community resources, and other times they might need a package of care from adult social care to help them meet their care needs. And that's a part of the assessments and the reviews that we do, and we work under the Care Act. So we also consider a person's eligibility, what their care needs are, and how these needs can be met. On a regular part of the day will be joining multidisciplinary team meetings. So in my role, I do attend a lot of meetings, and they're often with our partner agencies, our health colleagues. It might be ward staff, it might be working with the mental health staff, it might be working with housing, or it might be working with police. We also need to allow time in our days for writing up our assessments and reviews and our case notes. Although the meetings are that point of connection with the person, unless we actually record our findings and our decisions, we're only halfway to helping the person. We work really hard to evidence clear decision making, why we've come to our conclusions, if we've considered someone's capacity about a specific decision, if they've got someone who can support them, who can advocate for them. We consider any safeguarding issues and if we need to offer or provide any intervention to help keep a person safe. If we can go to the next slide, please. So looking at the rewards and the challenges of the job. So in my current job, the rewards are seeing the people that we're supporting, having their views heard, their lives improved by the support that the social worker gives them. Seeing the work that we do make a difference to someone's life, seeing them achieve a level of independence, and enabling people to feel a level of control over their lives. Another reward is seeing the achievements of my staff, seeing them grow in their confidence and autonomy as a worker. I've been rewarded in my own career as a practice educator, and I see the students that I support go on to be qualified practitioners. I'm also rewarded by seeing my own development and how far I've come, and I recognise the struggles that I've overcome to get to where I am today. The challenges are fairly simple, but can impact on every aspect of the job, regardless of your role, and its time and resources. This can be a very pressured job with demands from staff, service users, other agencies, all trying to get the outcomes that they want as quickly as they want. Not everything is straightforward, as sometimes there can be a pressure to complete tasks, and that's where we have to make sure that we're risk assessing and weighing up our priorities. Resources can be another challenge, be it the resources that are available in the community, the availability of a placement in a care home, or the availability of a care agency that we need to be able to secure someone some support at home. Or it might be the resources of staff in order to allocate cases to be able to do the assessments and reviews to be able to support our citizens. As already said, this can be a very pressured job. So the ability to manage pressures and stress, to remain calm and focused, the ability to prioritise and risk assess are daily key elements of our job, and they're all skills that we have to learn and develop over time. And if we can go to the last slide, please. And it's the advice to my younger self. So when I look back over the 8 years that I've been qualified, I would like to take time to remind myself, take time to reflect, absorb as much information as you can, and hold on to every experience. Every experience you have, including those that you might define as a bad experience, it's an experience that you can learn from. Embrace the experiences as learning. See how you can adapt your practice so that you can improve your own skills. Be open to the advice and experience of those around you, and most importantly, keep going. Thank you, Kate.
Oh, thank you very much, Ruth. That was fantastic. Now, you are going to come back and join us in a little while, aren't you, whilst we go through a case study? But before that, we're going to hear from Sally. So Sally also works with adults, but in a slightly different service. So Sally, there you are. Welcome.
Hello, Kate. Hello, everybody. Thank you for coming today.
Please take it away.
So I'm just going to say a little bit about me. As you can see, my name is Sally. I'm an operational team manager within Essex County Council Adult Social Care, and I work for a neighbourhood team, which I'll explain more about later. Next slide, please. So my career journey also started later in life, having left school and qualified as a florist originally, and then having 4 children and becoming a single parent, I decided I wanted to demonstrate to my children you can achieve anything you actually want to achieve in life. So I did come out of school with only 1 GCSE and went back in my adult life to study, obviously to get my GCSEs, which led me to undertaking a psychology degree. Having undertook a psychology degree, which is the person in society, I decided I wanted to know more about the society around the person. Therefore, I completed the sociology degree. But I've never known a sociologist following a degree. Looking at my options, and at that time working within secure mental health hospitals, I didn't like the way that some actions were taken for adults, and I wanted to make a difference, which is when I went to undertake a social work master's. From that, I've since completed my PEPS level 1 and 2 training, which similarly to Ruth is the practice educator training. And I've also undertaken a further qualification in that to expand on my experience. And I am a mentor. So I have been responsible for 14 students, 6 apprentices, and mentored 4 practice educators in training, contributing to the social work profession. So I started my journey as a newly qualified social worker, which within Essex is part of a programme which is an assessed year of supported employment. Following that, I was obviously a qualified social worker. Shortly later, I was successful enough to become a senior social worker through the experience and dedication to my profession. After this senior social worker position, which I spent about 18 months in, I was successful in deputy manager positions, which was new position to Essex County Council, where I remained for 3 years. I've now been an operational team manager for just over 3 years, and that's where I'm at today. So a day in the life of a team manager does slightly differ from a day in the life of any other post. So I am responsible for a team of 15 workers, ranging from social workers, seniors, deputy managers, all in social work, as well as senior occupational therapists and community support workers apprentices. So what would be expected of myself and all staff would be that they log in and check in their emails, look at their Teams messages, because that's the system we use, and also check their calendars for what their day looks like. I speak to members of the team. I have check-ins and updates first thing in the morning, like many of the teams in Essex County Council. I share important information that may have been fed down, which is relevant to practice or changes within the organisation. And then I have a look at we use a system called Mosaic. So I check in on my system to see if there's anything that needs my urgent attention that's been sent to me by the staff. I'm also responsible for holding a financial budget and managing that financial budget. So therefore I have to do budget approvals. That comes after the workers have done their Care Act assessments, reviews, safeguardings, and so forth. So with the assessments and reviews and the safeguarding, social workers will go out to people's homes or a place that's relevant to that person or a care setting. Sometimes they come to our office spaces or maybe even a Costa Coffee to gather information. And information gathering is about having conversations with the adult, with their carers, families and other persons around them. Sometimes we have to liaise with other professionals with consent, of course. However, under safeguarding, if somebody's at risk, we can actually speak to other organisations and other parties without the need for consent. We may establish whether somebody has mental capacity to participate in some of these assessments or information gathering processes and complete a mental capacity assessment under the MCA 2005. Could I have the next slide, please? Thank you. So we also, within my own role, I'm responsible for overseeing what we call the prison stream and also the asylum seeker stream. So as I work in a central part of Essex, we do have a prison which lays in my area. We receive referrals from the prison when they feel somebody may have needs for care and support, which is some people may find unusual that people with care and support needs are in prison, but they do have a medical ward also. And we will go into the prison and people will be treated with the same dignity and respect as those in community, and services offered would be extremely similar, with the obviously exception they cannot be put into a residential care because they are detained under Her Majesty's Prison Services. We also have 3 asylum seeker sites within the area in which I'm responsible. And these are all adults that are seeking asylum. We have one with just males, young males, who we do tend to find do have need for care and support, but mainly under mental health. And we also have 2 other areas where they may be families or couples. We also go and assess these people under the Care Act to see if they've got any needs for care and support, or if they need signposting or onward referrals. Very similarly, again, to what we would do with anybody living in the community. We do not practice with any discrimination or judgment for somebody's circumstances or the situation in which they've found themselves, nor do we discriminate against need, disability, or any other characteristic. So as a manager, I do actually undertake casework myself. I have simply wanted to continue to practice as a social worker because that is what I signed up for originally. So I too will go out and undertake Care Act assessments in people's homes or other settings. I will review current care and support packages. So that's the plan we put into place to help somebody meet their needs. I undertake safeguarding, so I investigate any concerns and we look at what can be put into place to support an adult to manage risk and to live safely. I have an extensive amount of meetings as a manager. I am the bridge between higher management, such as director service managers, and the workforce. So I am taking up a lot of my time in meetings. Then information from those meetings do get fed down to my staff. I'm more of a strategic role in terms of manager than a deputy. So whereas a deputy and the manager do both have manager responsibilities, the team manager does have to look at the strategic elements such as performance, sickness, absence management, data analysis, and so forth. They will be responsible for undertaking any task with HR in regards to the staff or individual or as a team. They're responsible for ensuring that training is up to date, all mandatory training, registrations are current, and obviously address any issues if they arise. Thank you. So, rewards and challenges. So, my job is very rewarding. I could not imagine doing anything else in my life, and I look forward to going to work every day. So, I get to work as part of a team. We have very good relationships with the team and support one another, which is really important in social work. I'm part of the leadership team, so I get to see things and hear things before they're rolled out. So all new plans, I have the opportunity to contribute my thoughts, my feelings, and to see if I can help shape some of the decisions that are made by the local authority. I have the ability to support and inspire others to be the best they can be, to do a good job, and to work with the adults and residents of Essex to achieve best outcomes for everybody. I meet an enormous amount of new people and build really good, positive, collaborative working relationships. Most of this is through the integrated network team, which is where everybody from social care, voluntary sector, different health settings, and other organisations all come together once every 2 months and just meet, chat, get to know one another, and discuss concerns and how others can support with a case. So if I'm working, for instance, with an adult with some mental health needs, maybe drug and alcohol issues, and they've got like a lack of insight into their medical needs, I can talk to social prescribers, the mental health teams, and other organisations and charities to come together around the person to offer a holistic level of support. I, the same as Ruth, work to many multidisciplinary team meetings, of which I chair, to affect outcomes for adults. I see growth of others. So I get to see people flourish in their jobs, have new learning. I am very fortunate when you're having discussions, you get to see that I understand moment in people. You see them progress through their own careers. I've seen students, apprentices alike, progress to be qualified workers. I've seen qualified workers through to becoming seniors and up the chain. So I get to continue with my own professional development. So that's not only a professional standard, which ensures that I continue my registration as a social worker, I get to flourish in what I do. And every single day do I learn something new to be a better professional and better person. I make a positive difference, whether that's to the adults of Essex, their carers, other professionals, or to my team, and other teams alike within Essex. I do make a positive difference, and there's something I reflect on every single day that has made a difference to somebody. And I get to work with crisis. Many people are concerned by crisis, but I love crisis work. You can make an immediate difference with just a phone call, and that means the world to me. So the challenges, I'm pretty sure everybody heard Ruth talk about the challenges in terms of time and resources. The challenges are exactly the same for our team, for my role. Time, there's never enough of it. And resources, whilst we do work with the INTs as previously explained, there does still seem to be gaps of resources which would benefit the adults, and that's where gaps have to be filled. So that's usually a challenge. And my role is very, very stressful. It is a high stressed role, and it does take a large amount of reflection and relaxation. More importantly, you have to be able to let go at the end of the day and ensure you've done everything you can to ensure people are safe, and then walk away and have a little bit of your own time. The roles sometimes itself are very challenging. So if you're, for instance, a newly qualified social worker, your role can be very challenging because you're learning to balance that new role, the new profession, with not full understanding and knowledge where you would like it to be. So those are the challenges I see in social work. So the first thing I would say to anybody, especially my younger self, would be to look after you. Ensure you have self-care and really put yourself at the forefront of everything for your own well-being, and love what you do. If you're not loving what you do, you can't do it well. Remember, you can't solve it all. You may feel like you want to, but you cannot solve it all, and you need to be okay with that. Be the best that you can be. That's all that's expected of you. And to know you are good enough, regardless of what situation you're facing that day. A little kindness means everything, and that's not only giving a little kindness, that's receiving kindness, which social workers find hard to do. And ask questions, literally ask. There is never a silly question. And I would say you do not know what you don't know until you know you don't know it. Thank you,
Well,
Kate.
thank you again. Yeah, we'll have Ruth back if you're there. So you've both prepared a case study. So this is just going through an individual that one of you might work with, and how you'd support them and the issues that may arise for an individual to work with. So I shall let you start with that one. Thank you.
Thank you. So I'm going to introduce Beryl to you. And this is an example of one of the cases that we've had at some point. So all the names are anonymised, just to reassure you, so that there's no way to identify this person. So I'm going to call our lady Beryl, and Beryl is 80 years old, and she's a white British lady. She has interests. She loves birds, and she likes to sit and watch the birds out of the window. Previously, when she worked as a secretary, and when she was at the age of 62, she retired. Beryl also used to volunteer at her local church and in her local community. Beryl had a pet cat who was called Peter, and he sadly passed and died some years ago. So if we can go on to the next slide, please. So Beryl's current situation. She currently lives in a residential home. She's cared for in bed, which means that she spends all her time in bed. She's not able to mobilise very well. And so all her care, her personal care, is provided with her being in bed. Beryl has a daughter who visits twice a week. So Beryl has been assessed to lack capacity, and that's around the decision about her care and support needs. So she hasn't got capacity to make decisions to say how she wants her needs to be met. And so a best interest decision was made, enabled to support how her needs can be met, and these are anticipated for Beryl. So if we can now go on to the next slide, please, and Sally's going to continue for us.
Thank you, Ruth. So, a safeguard has been raised as Beryl's daughter has found her mother as not having had personal hygiene tasks completed. This means she hasn't potentially been washed and changed, and she hasn't had her continence care. She's been saturated with urine and in dirty night clothes with no fluids nearby, and the daughter felt that she had a dry mouth. Beryl's daughter always visits late in the morning, so we would expect somebody to have already had their continence care, personal care, breakfast and fluids by that point. Beryl's daughter advised this happened on at least 4 occasions recently in times that she has visited. But this could have happened more often because there are days where her daughter doesn't visit. It is reported that although staff do attend to Beryl when her daughter requests this, it is often difficult to find a staff member to report the concerns to. This would cause concern if the staffing levels are correct and whether or not Beryl has actually been seen already that day.
So as a part of our safeguard concern, as a worker, as a social worker, what we have to do is actually break things down a little bit. And these questions here are a useful sort of guide as to working out actually what are the concerns and what we need to do. So the first thing will be to say, well, what is the actual incident? So from that example that's been given, well, we can see that Beryl hasn't been receiving personal care, so she's actually being left in dirty clothes and dirty continence pads. So that will be the incident. And from that, we identify what is the form of abuse. In Beryl's instance, that will be neglect. So she's in a care home, she's in a residential care home, and staff are meant to be looking after her. And so they're neglecting to do their duties. So what do we know? We know that her daughter visits her and visits her regularly, and she's seen this the way that Beryl's been about 4 times now. But what do we need to know and why? Well, we don't know if that's just in a short space of time or is that 4 times recently over a period of months. Getting a bit more information actually gives us a better idea to be able to work out actually what is the risk to this lady. If this is something that's happening over 4 days and she's got a really dry mouth and she's not having fluids, that's very different to on an occasion once a week or once every 2 weeks she's not having a drink. So that's why it's really important to get that information. And we can get that information by asking for care records from the care home. As the statutory body, we and the local authority, we've got the right to request that information, and the care homes have to provide that to work alongside us. So people we might need to contact and why. First and foremost, always try and speak to Beryl. Always try and talk to the person to see what actually is going on for them. It might be that Beryl doesn't get on with her daughter, and actually there's a little bit of sort of friction going on, and her daughter's stirring things up for Beryl. So that's why it's really important to speak to Beryl, find out actually what's going on for her. But you can speak to the daughter. It might be there's other family members. It might be you need to speak to a GP. It might be you speak to the care staff and the care manager to get a better understanding of the situation and what's happening. And from that, that's what's going to help us, and that's what's going to inform our decision making. We can't go in and decide, yes, this person's been neglected, if we don't have all the information. If we haven't asked questions and uncovered as much as we can, we might actually be making the wrong decision and saying that this safeguard has actually been what we would say is substantiated, which means, yes, we agree that there has been an element of neglect that's taken place, when actually we haven't got the full story. And so, and other things that we might use to help our inquiry. So that's about our real collaborative work. We would also make sure that we look at all the past history. Have there been other safeguards raised around the same incident. Is this a really historic thing? Is it something that's ongoing? Are there other people in the care home who are also being impacted by this level of care from staff? So it's really good to be curious, to use, we use systemic practice, which is looking at the systems around, looking at what's going on to be able to help us get a better understanding. So if we can go to the next slide, and I'll hand to Sally again.
Thank you, Ruth. So managing the risk, it's really important any risk is identified and managed effectively. So how will the risk be managed? In order to manage risk, we need to understand the incident, what has occurred, and how it has occurred in the first instance. As Ruth's already explained, that it can be done through the information gathering process and gathering evidence to understand what needs to change. We also have the use of a shared care record where we can have a look to see if there has been any GP involvement or any other professionals involved at this stage. For instance, it may actually be not the care home that's neglecting Beryl. Beryl may have a deterioration in their mental health, for example, and actually be declining the care. And you need to be aware that we cannot enforce care on any adult, regardless if they have capacity or not. This would have to be an order through the court. So what tools can be used to explore the level of risk? So firstly, as I've just mentioned, we can use the Mental Capacity Act with Beryl to understand if she understands her care and support needs. We can use the Wanacott matrix. So the Wanacott matrix is a tool which we can say, what do we know? What do we not know? What is ambiguous? You can compartmentalize all of your thoughts, and it's a tool used to really understand what further information we need and what risks have already identified. In Essex, we have a tool which has been created, which is for the whole of the workforce to use, called the Risk Priority Matrix. There are a number of identified risks which we can have a look at, and they are levelled either P1, P2, P3. The P stands for priority. So is it a priority that the risk is being managed at this stage? Is there something further we can do? Do we need to continue to monitor, and actually we do not feel there's really a risk at this stage? So we use all of those tools to understand the priority and the risk towards Beryl, and then we will put in what we call a risk management plan. So if we go for the example that actually the care hasn't been provided to Beryl, they've been really busy, they've been very short staffed, a high turnover of staff, we may refer to what we call our organisational safeguard team, for example, because at that point we would recognise that it's not only Beryl at risk in that care home, it may be all other residents. They can work with the care home to reduce that risk by ensuring they work with them to look at their staffing, how they deliver the care and support, and what they need to do to improve their standards of care. It may be, for example, that we say actually she needs to be on observations every half an hour rather than hourly, because it could be that when Ruth has gathered her information, for example, actually they are delivering the personal care, but this lady has a high level of continence and actually she has a condition that makes her mouth dry. So there may be sort of room for working with the GP and collaboratively with other organisations to ensure that those are addressed through medication, for example, or the continence team. We also need to understand if there's any other risks rather than just a dry mouth and poor personal hygiene. So if somebody, for example, is sitting in wet continence pads for a very long period of time repeatedly, this could cause pressure areas and pressure sores, which could lead, unfortunately, to sepsis and ultimately lead to death. We may wish the continence team to come in and support to address how they can better support the continence areas. So there's lots of things we can do. And as you can see, one of those things would be referring and having an MDT approach to supporting Beryl. It may be that just the risk management plans and the care plans within the care home need updating, which we will support to do if it's necessary. We also need to understand, actually, is this the right placement for Beryl? She may now have nursing needs, for example, in which case we would complete what we call a continuing health care checklist, which can be found on the internet if you want to have a look at that at another time. This is the initial assessment that leads to the decision support tool to see if there's a primary health need or if there's a nursing care element. So it may be that the residential home is not actually equipped to manage all of Beryl's needs. So there's many things that we can do. We can work with the family around expectation as well. Sometimes family feel that somebody should have somebody with them, a one-to-one, and as soon as they unfortunately pass urine, that pad needs to be changed. This is not always possible because there's other people in the residential care that also need continence care and personal care, and not everybody can have somebody with them 24 hours a day. So as you can see, there's lots of things that can be done. All of these actions that we would recommend go into what we call a risk management plan. That is shared with all organisation and parties involved in the safeguarding, as well as the adult and the family. And everybody has to sign up to say, this is what we will do to ensure this adult's care and support needs are effectively met and the adult remains safe. How can we monitor the risk? We will undertake reviews regularly. The local authority has a statutory responsibility to review every adult's care and support plan at least once every 12 months. The risk management plan would be reviewed within 4 to 6 weeks, as with the care and support. We always do a follow-up review following a safeguard or any changes made to a risk assessment or care and support plan for all adults, regardless of what that need is or the level of support offered. Thank you.
Wow, thank you both. That was a very detailed case study. We've got a couple of questions for you, if that's okay. So one of the questions we've had is, how do you go about prioritising your caseload as a social worker?
Would you like me to answer that one, Ruth?
I think you already have, but yes.
That's fine. So we have a risk priority matrix anyway that supports practitioners, regardless of the profession, because we do have occupational therapists as well, as I've already explained, within the service. And we will have a look at that. Now, on a day-to-day basis, the most important thing is to keep an eye on your emails and your what we call ladder, which is where all your cases sit, for any concerns or contacts that come to the team. We have procedures in place, which would be to seek support from your peers if something's in crisis, to oversee something else you have, or maybe to manage that crisis if you've got another crisis going on at the same time, which often happens. So we do have those mechanisms into place. And also, in order to manage that risk and prioritise, it often escalates through the seniors to the deputy manager and through to the manager to ensure we can maintain safety for every adult. So the basic line is keep your calendar up to date, check your emails and respond accordingly. Most importantly, communicate. Absolutely communicate. The social worker is not always responsible for managing the risk, so it's communicating with families and other organisations as well.
Thank you. So how are referrals made into your teams? Who can make the referrals?
I don't mind taking this one. That's all right. So referrals can come in sort of in various different ways. We have a team called Social Care Connects, which is what we call the front door. So if someone's wants to make a referral to adult social care, they can contact that number. They can go on the Essex website to find out how to contact adult social care. And that's like that front door, which is I've got a concern about for example, say for my mother, my mother doesn't seem to be managing very well on her own, and I think she might need a care act assessment. She might need some carers to help her out. What do I do? So Social Care Connects are a team of staff who will take those initial information. If there's anything that urgently needs to be done, they're able to facilitate that and put that through to being able to source some care urgently. But they will then decide what team is going to be best able to meet this person's need. So it might be if they're new to adult social care, they will go to one of the neighbourhood teams. Sometimes we have if someone's been admitted to hospital and then they need ongoing support from social care. So then we have our hospital discharge team who works alongside the hospitals to be able to support the people to be discharged, or whether that's discharged back home with a package of care, or it might be discharged to a residential care home. And then adult social care will come in and then take over and do those reviews to see what that ongoing care looks like. But you might have healthcare professionals, so it might be the GP. I've had banks make a referral before because someone's gone into their bank, and actually, as the staff member at the bank is talking to that person, I think that there's something not right here. I think this person's really struggling. And so we've had a referral from a bank manager, for example. So that initial social care connects where people can make contact, that can be anyone.
Thank you. Thank you. Now, you've given us a really good example of the sort of activities you do. So what would you both say, should we start with Sally on this one, are kind of key characteristics and skills that you need to have if you want to be a social worker?
Professional curiosity and active listening skills are the absolute key. Secondary is good analysis, the ability to have professional analysis on all information gathering. They're the three main skills I would say were required initially.
Thank you. Ruth, have you got any to add to that one?
I think I would add to that reflection. Being able to be a reflective practitioner is a major part of our job. Some people might feel that they do that naturally, but it is something that you learn to do, and it's being able to learn from the situation you're in. So there's always a way to look at a situation, say, okay, this is what happened, and then you reflect to say, well, this went well, but actually I could have done this differently. And by using that reflective practice and continually looking at what can I do, what can I improve, what could be done differently, we're going to widen our skills, and that goes towards what Sally said about our analysis, being able to do that. So being able to reflect, to stand back and look at what's been going on, and actually sort of take time to look at that situation, that helps us in our analysis and in our decision making.
Thank you. Now, both of you have had very different journeys into your role as a social worker. So I think, Ruth, you're going to tell us a few kind of different pathways people can potentially follow in order to become a social worker.
Yes, thank you. So as Sally and I have both done, we both did a social work master's degree. For the role of a qualified social worker, it doesn't have to be a master's degree. There's also the Bachelor of Arts degree as well. So a qualified social worker will have one of those degrees, which then qualifies them for the role of social worker. Not everyone comes straight into Essex County Council, though, having gone through that pathway. Sally explained in her team, she also has community support workers. So you don't have to have a social work qualification to be able to do that role. They work alongside the social workers. It's a similar role, so they will still be completing assessments or reviews, but they will need more oversight from managers for some tasks, so things like safeguarding or mental capacity assessments, it might be there's a bit more oversight. But when someone's worked in Essex, we have an apprenticeship programme. So if you've worked for Essex County Council for 2 years or more, then there is the option to apply for the apprenticeship programme, which means then you stay as an employee of Essex, and then you do your social work degree as a part of your employment. So that first year will be placed in a social work team, and then you would have 2 years of placements. There are also other programs that I know Essex do, and some other local authorities may as well, but they're things like step-up programs or fast-track programs. So sometimes I've supported a student who was on a program which within the space of 2 years did her qualification and her post-qualification year as well. So there are some programs which can be very intense. I think all of that information is also available on the website as well, so it's worth looking at.
Yeah, because it is slightly different, you were saying, isn't it, for
There
different
are,
areas. So
absolutely.
they will have different routes in. So don't assume just because one area does apprenticeships all will. It really depends on capacity and
Yeah.
their programs, doesn't it? Thank you. So, Sally, both you and Ruth work within adult care services, but there are lots of different areas you can work within social care or social work. Can you kind of give us a few examples of the different areas you can work in?
Of course. So I will move on to our sector, which is adult social care, shortly, but we do have children's social care. People will understand that there is a children's social care in all local authorities. All of them will have an access and intervention, which is the first sort of front door team in social work services. There's many other teams, just to name a few. There's children and young people with disabilities. There is the leaving aftercare team, adoption and post-adoption teams. So there are various children's teams, and that's the same for adult operations. So, for example, in the part where I work in a neighbourhood team. So I work with adults aged 18 plus. There's no age limit and there's no specific service user group. So, for example, it may be learning disability and autism. There could be low level mental health, physical disability. Sometimes we get access for homelessness, drug and alcohol. And as long as they've got needs for care and support, we do have a statutory duty to assess. So we also have our discharge to assess teams, which Ruth kindly touched on earlier, who work with people who are being discharged from hospital following being admitted. They do not work with people who had just gone up to A&E or just popped in because they're not feeling very well. It is for people who have been admitted to hospital, who may have needs for care and support, who require that to be put in place upon discharge. They will work with the ward, who will often look at what the care and support is and support to assess those individuals. We have what we call 3 focus teams in each of the quadrants in Essex. So it's the older adult mental health team, the learning disability and autism team, and the physical and sensory impairment teams. And they literally do what their labels say. And then there's other such teams, such as mental health. So there's our mental health and wellbeing team. There's a team that works with alcohol services who are also with mental health. We're not a secondary mental health service, however, and I do feel the need to express that. So we work with those that may have dual diagnosis, but only on a low level, and the predominant need is not necessarily mental health. But we do have other teams, such as I'm gathering Ruth's team, who do work with those with some element of mental health. They're just to name a few of the teams that we have across Essex.
That's a massive variety. Now, how easy is it as a social worker to swap and between teams? If you, for example, worked with children for a while and thought you might like a different challenge, so want to try a different team, how easy is it to kind of move around?
So that's very possible. I have literally just had a worker from Children's join our team because she decided she'd like to experience adults. It's a simple transfer, providing there's a position available, as in a vacancy, then anybody can apply for that. Internally, people can have manager conversations, so they have to advise their manager they'd like to move to a different team. Their manager will have those conversations and explore any vacancies that we may have. Um, Within the same level of service, so for instance, adult operations, I have worked in learning disability and autism. I've worked in the physical impairment and sensory team and what are now known as the neighbourhood team. So there is always movement available and progression.
Lovely, thank you. Now we have another question. So, how do you manage the reactions of people who refer to you for social work intervention? For example, are they always welcoming, or do you occasionally get quite a negative reaction to you stepping in to support somebody? How do you kind of deal with that and manage that?
I can step in on
Yeah,
this one if you like. Yeah, whoever's put this question in, yeah, absolutely right. It can be really challenging. You know, it would be lovely to think that every social worker is welcomed into someone's home, and they're really happy to see us, and so many people are. But there are also people who are very private. They don't want anyone coming in and offering support. And as a social worker, especially if you're there to complete an assessment about someone's care needs, you're often asking really personal questions as well. We've looked at that example of Beryl, where we've talked about her personal care and talked about her continence needs. They're really sensitive questions that we're asking people. So I think the biggest challenge and the biggest skill that the worker can learn is about how to be kind, how to be respectful, and to use those listening skills to be able to observe someone's response and to maybe look at sort of de-escalating. If you can tell that someone's upset or angry, maybe just to take a moment and say, is this a good time? Is there something that I can do to help you? Is there anything in particular that you seem a bit upset? So it's learning on how to use language in a positive way to be able to make that rapport with someone you're working with. It's really hard to ask people for information if you're very cold, there's no eye contact. So how we physically behave in someone's home or at their bedside in hospital, and we make them feel welcoming, that can make a big difference. But sometimes you can get have family members who can be really challenging because they've got their own preferences on what care they want for their parents. And sometimes you have to be quite firm as a social worker to say, well, this is my assessment, and this is the outcome that I can offer. And actually, people don't always have to agree. But it's about being confident in your own skills. It's being confident in your assessment skills and confident in the decisions that we've made, and then how we can respectfully communicate that and see what options there are available to try. And actually, it's about keeping the person at the centre rather than trying to meet all the family members' sort of wishes as well.
Yeah, because I imagine that can get quite messy if family members have got very, very strong ideas about what should be happening, and it might contradict the individual themselves and what they want.
Absolutely, it can do. So it's really important to keep the person that you're there assessing their needs, to respect their views and wishes, to listen to the other family members, but ultimately to be able to demonstrate, I've listened to you, this is my assessment, and actually this is what we feel is the best way that we can meet your mother or your father's needs.
Thank you. Now, we're just about to finish, but I am going to put you both on the spot. I'm going to ask you maybe to share one of your happiest memories from working as a social worker. Obviously, you have to make sure it's anonymised, but what is that one thing you go back to and you think, oh, that was a good day? Has anyone got one who would like to start?
May I?
Yes, thank you.
It's sort of two in one, really. So I had two students, social work students, a few years ago, not many. And I supported one of them to attend the Social Work of the Year Awards, who won the Social Work of the Year for a newly qualified social worker.
Wow.
And having been her practice educator and mentor, that was a very proud moment in my life. And the second one, who was also a student at the same time, I have watched flourished into a very good senior social worker. So my moments literally are watching people grow and being a big part of that.
You did actually mention that as one of the biggest rewards of your role as well, didn't you? Now, Ruth, sorry, we're going to come to you. Have
That's
you
all
got
right.
one?
No, that's fine. Something that came to mind, it's not a particular day, but it's a particular lady and family that I worked with. This is quite a few years ago. One of the teams that I've worked in supported people with physical disabilities, and this particular lady had multiple sclerosis. And I worked with her for over a period of about 4 years. So it wasn't a sort of initial assessment and there we go, we put care in place. But it was an ongoing, because this lady had an ongoing condition. And it was about ensuring, sort of listen to this lady and listen to her family members. And it got quite complicated with the care hours, and even though there were different family members pushing, actually this lady, in all of it, her voice was heard throughout all of it. I left that team sort of, so my work with her was for about 4 years. And I did find out a few years later that eventually she had died, but she was able to stay in her own home. She had adaptations put in place. She had the care support she wanted to in place, and she was adamant about how she wanted to be at home. So that's something I think that does make me feel proud, is when we've been able to support someone to achieve what they want to, despite the difficult circumstances they find themselves in.
Oh, no, that's a good story. Thank you both. Well, a massive thank you to you both for volunteering your time to join us today. We do appreciate that you take time out of your massively busy workload to come to us and talk to us about your job roles. So that's it for today. As always, we'd love to hear from you. If you'd want to give us some feedback about the session and share your thoughts, you can just follow the QR code on the screen and give us some information. Let us know what you think. So again, thank you for joining us today, and we look forward to seeing you again. Bye.